Hello, good morning. I welcome all the viewers of today's Instagram program, and we're going to discuss today about a very important topic which is very relevant to the current situation. So, working from home, and we're going to talk about what are its effects, and also we're going to talk about how we can avoid any problems that come related to working from home. இப்போ ஃபர்ஸ்ட் what I wanted to explain and discuss with you is about what are the effects and what is this working from home. Normally people do work from home, mainly people in the IT profession, because they can manage their work from home. But now it's become that a lot of people who are never used to working from home are kind of pushed into working from home. They are probably people in healthcare sector, in every other industry, people have now been kind of pushed to work from home. So what is this work from home has done to many of us? See, people who are normally used to working from home, they have, appropriate area where they divide between their family and their work, like a work desk, a chair, table. Usually work from home is computer-based work. People have good bandwidth of their internet to connect with their workplace, and they have frequent breaks and they meet up with people. But what's happened right now? It's suddenly you've told that from next week you're going to work from home. You probably don't have an excellent internet connection. You don't have an appropriate area where you have kind of marked where you work from home. You don't have an appropriate maybe a chair and a table. You're going to be working on a laptop most likely than a desktop. So all these things have given a lot of discomfort to people, and also working in an unfamiliar environment, like at home where you have children, you have pets, you have the cooking going on one side, the television on the other side, you have elderly people at home. So all this has caused a lot of stress, and being isolated into the community, from your workplace, from the community, it's also caused some kind of a mental distress, because you're normally used to talking to a friend or getting a doubt cleared from your boss, or you probably have people you can go out for a cup of coffee, you can socialize, you want to meet your friends, and the environment is totally different, and now you're like within four walls. You're stuck, you don't know what's happening in the outside world, you're not able to connect with people you want to connect, you cannot clarify your doubts, and that clear demarcation of say a 9 to 5 job is now very blurred. So you probably start work early, you finish late, you probably want to join your family for a movie in the afternoon, and then you carry your work to the evening. So there's a lot of problems with working from home. So what has this led to? One is it's led to social isolation. So that's caused you a lot of mental distress to many people, depression, anxiety, not able to solve your problems, especially if you're very junior in your workplace. You have to call somebody, ask for doubts, and you may be hesitant. Second thing is you're sitting a lot more. You're confined to your house, and with the lockdown you cannot go out for a stroll or a walk to a tea shop, so you're stuck within your house. So that's causing a lot of back problems with your neck, a lot of strain and stress and injury to your back. Then the next thing is you're sitting, and so you end up munching some food, you're eating a little snack, you're drinking more tea and coffee and other things than often. You're going to put on some weight, unless you are very good with following a routine and some exercises or stretches. So that's again going to cause obesity, and in turn all this can lead to so many other problems. Well, I'm not sure if you're familiar with this term called sitting is equal to smoking, which is the current smoking is the sitting. What that means is somebody who is sitting for a very long period of time, you're going to develop a lot of stress to your back muscles. You're going to develop lots of other problems, like you'll be shocked to hear cancer. There's an increased incidence of cancer for people who sit and work throughout their lifestyle. There's an increased risk of heart attack. There's an increased cause of anxiety and depression. There is an increased risk of back and neck problems, which can lead you to very serious problems and surgery. at a much younger age than the normal wear and tear, which takes a much more longer time. Your obesity can cause you diabetes, hypertension, heart attack, stroke, all kinds of problems. So really, we are saying that when we consider smoking as so harmful and causes all these problems, now the current concept and the current generation is facing a problem with sitting, because we are more into jobs which involve sitting. If you look at our human spine, we are actually not designed to sit. Yeah, so the human body is made to stand, so that is why we are quadruped. We are bipedal, so we are on two legs. And our muscles, our joints, our spine alignment, our pelvis, and everything is aligned in such a way for us to stand, to run, to be active. Whereas right now, do you know on an average how long you sit in your lifetime? So if you are an IT professional and you're going to be sitting anything between about say 8 hours at work, another 2 hours to commute, another hour or two work from home, you're going to be sitting an average, if you live a lifespan of 75 years, you're going to sit for 32 years. So that's a long time of sitting. So that's not good for your body and not good for your health. So by prolonged sitting, I mean somebody who's sitting for like 8 to 10 hours a day and continuously sitting for more than 1 or 2 hours. So some people just don't move out of their seat for 2 hours and just sit there for 2 hours, which is not good. Now, what can you do and what are the other problems that can happen? Let's talk more specific to the spine and let us talk about what it is, because I'm Dr. Balamurali and I'm a spine and neurosurgeon leading the spine department at Kaveri Hospital in Chennai. So my interest today is really going to be talking about what are the ill effects of sitting, of working from home, that's going to do to your back. Now, let's look at the neck muscles. So if you understand the spine is a set of bones starting from your neck all the way down, and it is closely got together and it is working synchronously with the muscles and various other joints. So when the muscles are strong and there is no stress on the muscle and there is no injury, then the wear and tear process, the normal wear and tear, it is like, when you are, as you age and get older, all your muscles, your joints, they all start getting wear and tear. It is like an machine in your house or your car. The car parts, the car is not going to last for 50 years. So it's going to have problems, wear and tear problems. The tire will wear, the engine will wear, everything else will wear. So similarly, the body wears and there's a wear and tear process, and the spine is one of that gets affected. Normally, we used to see people at the age group of 50 and 60 who will come with spine problems. But currently, especially on a Saturday, we used to have a lot of patients because the IT offices are closed or they don't work on a Saturday. So you have a lot of IT professionals in their 30s and 40s who have severe back and neck problems. And that is because they're sitting for a long time. So now let's look at what are the injuries that can happen. So when your computer or your laptop is not aligned properly, and if you're in a wrong position, you're looking down or you're looking up, then you have a constant strain on the neck muscles. So if you have this strain on the neck muscles for more than 4 to 6 hours, you're going to start developing neck pain. Along with that, we all have this device which really causes a lot of grief and problem. And this device, you keep using this on one side and you're working on your laptop. So this again causes you a lot of problems. It puts a lot of strain on your muscles. The next thing is when you're sitting, you need to sit erect. See, not everybody can sit in this position for a long time. So as we go on, slowly we slouch and we become like that. And by the end of the day, you slouch and you go back and you get into all these very wrong, awkward positions which are so bad for your neck muscles and your back muscles. So the next thing is your chair. The chair that you use is very important. So these are all the problems that you may face by sitting and working from home. So if you don't have an appropriate chair, if you don't have an appropriate backrest, then this is going to give a lot of stress on your back muscles because you're sitting continuously. And that would affect again your back and that would give you problems like mid-thoracic pain, the pain in your back, and lower leg pain and lower back pain. So all these things are going to happen. Then the next thing is, when you sit, you need to sit in an appropriate way at the workplace, such that all these muscles are relaxed and tension free. So you need to make sure that when you keep your hands on the table, the entire arm, the wrist should be supported on the table. So you shouldn't be either leaning forward to work and trying to get your mouse, or you shouldn't be relaxed too much backwards trying to do this. So it should be in an appropriate position where you're able to sit appropriately with the hands well rested, the shoulders well rested, and so you're much relaxed and you're working. Because as you keep doing work through the day with all the work stress, the muscles go into a lot of spasm and tension. Then the next thing is your eyes and your screen. So the monitor and the screen should be in an angle. It's got a broad width and angle. We can share some pictures later on our website. The angle should be maintained such that your neck is either not looking down or you're not looking up. So it's very important that your angle is straight in front of you. Most of us keep our laptop right on the table and we work like this. Instead, it is better sometimes to keep a pile of books or something and raise the level of your table. You can't raise the level of your table, but you can keep few things on your table, like 4 or 5 big books, and then keep the laptop so that it matches your neck level. If you have a desktop, it's probably easier because the desktop is slightly more higher than the laptop. So these are some things that you really have to look. The distance between the screen and your face should be about 18 to 24 inches, depending on the size of your monitor. So you need to be as further away from that. So working from home also not only causes a strain to the muscles, it can cause a lot of strain to your eyes. It can give you, chalazion formation. It can cause red eye. You can put a lot of stress by looking at the screen and the monitor. And all these problems can affect your eyesight as well, and your concentration, your lack of sleep, and so many other problems which most of you are already aware of. So now coming to, what we can do. How do we, make this better? All you've heard now is, so many things that can go wrong by working from home, but there are lots of things you can do to actually make work from home interesting. The first things I would suggest is setting up your table, your laptop, your computer, your keypads, your mouse, as I described. Getting a proper chair. I would definitely recommend that you invest in a good chair with a good back support, because if you're going to be looking at working from home another 6 months at least, so you better get a proper chair and a table. Then the next thing is, just make sure that you set up a routine and a pattern. Most people say that if you're working from home, try to keep to a routine. So wake up as you would go to work, have a nice shower, have a good breakfast, and come and just let your family know that you're going to be away for the next 2-3 hours, and then you'll have a break and sit in a room, isolate yourself, feel fresh, dress up well, and come and sit down and work. The other important things you can do are, so you're having a tea break, a appropriate lunch break, an appropriate time. You do have, frequent breaks. Talk to family, talk to friends, talk to your colleagues. Some of the ways that people have been trying is to have a team meeting. A team meeting first thing in the morning, so that that everybody else is well dressed, fresh, and sitting to work. So as a team leader, if you have a team, so what you could do is say that, okay, everybody, we are going to meet up at 9 o'clock for 10 minutes. You can just have a chat about how your day went, what's the plan for the day, what's the rest of the day, work that's happening, what's pending. So you have to get ready, you have to dress up, you have to look good, and make sure that everybody comes on their video screens. And so you start your day like that. And when you have a cup of tea, you can still do the same thing. All of you can grab a cup of tea and you can sit down and have a chat. Or so make sure that you are connected to the rest of the world. You're connected to your workplace, you're connected to your friends, so people know what's happening. And try to maintain that throughout this lockdown period and whenever you're working from home. In terms of what you need to do with food. And it's important to remember not to keep having too much tea and coffee and not to snack too much, because it's quite easy and tempting when you have a wife or a mom who spoils you and keeps supplying food to you thinking that you're working very hard. So try to maintain that. But apart from all this, the most important thing is to getting out of this chair and this table every frequently. So they recommend that every half an hour you should get up and walk for about 5 minutes. Yeah, you can just walk down, if you're in the first or second floor, walk twice up and down your staircase, or just pop into the kitchen or to your living room, just say hello to your family members, a quick phone call, but make sure that gap does not extend too much. A quick 5-minute break, walk up and down. Then we can learn a lot of stretching exercises. Kaveri Hospital, we made lots of videos about stretching at work, so we can share some videos if you write to us. So we can share those exercises you can do, just holding your chair, holding your table. You can do these exercises where you can try and do these stretches at work, because after some time, because you're sitting in a 90-degree, your hip and knee joints, they become stiff. And as you grow older, you already know that if you sit for a very long time, your knees and hips are all going to catch up. So I think it's very important that you actually try and stretch your muscles, stretch your neck, stretch your back, stretch your knees, do some sit-ups and some push-ups. So do those things for every 30 minutes, take a 5-minute break. Yeah, and during your lunch time, make it very clear you're going to be off screen for about half an hour or 1 hour, whatever lunch break you take, and totally disconnect yourself from work. Yeah, just make sure that you take that proper break and try not to attend any calls unless it's really important. It's also a tendency that because you're from work and you're not monitored, that you get into chatting, visiting your Facebook, and then a little phone call to a friend, catching up with those things. So try as much as possible not to do that, because that's going to add more to your stress and it's going to not allow you to focus and concentrate at work. So back exercises, neck exercises, I'm not going to show you right now, but it's very important that, especially if you're going to spend anything from about 6 to 8 hours at work, that you must do these stretches and exercises. Apart from this, you have to make sure you spend at least half an hour to 45 minutes every single day in doing fitness and exercises. It can be a jog, it can be a run, it can be exercises at home right now because you're locked down. But you have to do that. The more you are fit, the more strong your neck muscles, your back muscles, and all your other muscles are, you will not develop much of back and neck problems. You will not develop too much wear and tear very early in your age. So remember, these things are all so important that you have to follow them. If you don't follow them, then work from home can become very difficult. Yes, some people do enjoy work from home, but I guess most of you really want to go back, because my friends say that work from home has made their life miserable because there is no clear 9 to 5. They start work early, they have a nap in the afternoon, they work till late night. So there isn't a clarity of work. So we all hope that this Corona period really ends quickly, and those of you would really love to go and work in a workplace, that happens very quickly. But until then, you really have to take care of yourself. If you feel depressed, if you feel very low because you're stuck within your house, you have a work pressure, a committed time to finish your project, and things are not going well, there's power supply cut, your internet is not working, and it causes all these frustrations. The easiest thing is to talk to somebody, talk to a friend, talk to a colleague, talks to your best buddy, and just explain and relax. There's nothing much you can do. I mean, currently the world is controlled by Corona, so there's not a lot that you can do. But then if you still feel very low, you feel really down for whatever reason, talk to a psychiatrist or a psychologist or a counselor. Most hospitals are doing video consultations, and at Kaveri we do as well, and we have some excellent psychiatrists and psychologists. So talk to somebody, get help. The other important thing during this work from home period is do not ignore any symptoms that you may have, whether it is a chest pain or indigestion or anything, because people think that we are getting fitter because we are staying home, but actually that's not the case. I think we'd all prefer to be active, working, traveling, doing things outside. So working from home has a lot of disadvantages and a lot of advantages as well. But unfortunately, you have no choice right now, and most of us are all working from home. So I hope that we've covered quite a lot of things, and there are a few questions that I probably like to take that some of you have asked for, and we'll discuss further. Sir, I'm suffering from scoliosis. Recently, I'm experiencing numbness. Yeah. So yes. So scoliosis is a condition where there is a bend in the spine. So your spine is not normal and your spine is bent. And if you're sitting and working and doing a lot of stressful work right now, this can cause other effects like compression on the nerve, compression on the spinal cord, and this could lead to some weakness, numbness, and various other problems down your leg. So if you are experiencing this kind of a numbness, then you must consult a doctor. You can either do a video consult or you can drop into us at our hospital. It needs to be examined. Developing numbness in your legs is not correct. So it's very important that you need to look into that very carefully. So let me tell you some of the symptoms that you need to look out for where you must go and see a doctor. If you just develop a simple back pain or a neck pain, majority of times it is not serious. 90% of back and neck pains are not serious. They would get better by themselves with some rest, physiotherapy, and taking some painkillers or a massage. But if you develop back pain or neck pain, and if you have any of these additional symptoms, then you must visit a doctor. Say your pain starts shooting down your hands and you develop some tingling and numbness in your fingers. That's not right. If you're not able to hold something and you're dropping, or if you're not able to write, your signature is changed, then that you need to be worried about. If your pain is not going away with all these simple things, bed rest, taking some tablets and some exercise, and it's still persisting or getting worse, you need to see a doctor. If you develop any problems where the pain is going down your leg, if the pain is causing any numbness, and if you're not able to walk, you need to see a doctor. If you're not able to pass urine, you're not able to pass toilet, again you need to see a doctor. If you're losing weight, and even in bed rest, even when you're sleeping flat, you still have severe pain, then you must see a doctor. So all these things really would suggest that there is something more than just a wear and tear kind of back pain, and you should seek medical attention. Do not postpone. The problem that healthcare professionals we are seeing lately in the last couple of months is people are afraid to come to hospital. People are afraid to go out of their house, worried about the situation and the COVID. So they're postponing their symptoms. They're ignoring their symptoms as likely to be due to a back pain, something simple, or just a heartburn where they're missing heart attack, or various other infections and other problems. So not everybody needs to be worried. The COVID situation is going to stay for another 6 months. Do not ignore your symptoms. Do not stay away from hospitals. Hospitals does not mean you're going to go and acquire an infection. Most hospitals have separate entrances, separate working areas where we deal with COVID patients and the normal patients. So do go and see a doctor. The same applies to your back and neck as well. So there's no need for you to be afraid. There's no need for you to actually stay back. Yeah. There's one more question somebody has asked. Please tell us about the cervical spine disorder. So the cervical spine disorder basically is, any neck problem. So the cervical spine is the neck. So if you are constantly in a wrong posture, so one of the important reasons for developing back and neck problems is, one is wrong posture, which is staying like this on a phone. So to avoid that, you can use an hands-free or a Bluetooth or something like that. The next thing is the posture when you're working. You're either writing like this all day, or you're on a computer or a laptop where your neck is not neutral. The neck should be neutral. Even your television screen, you should not sit on the floor and watch your television, or you should not keep your television on the floor and look down. So your television needs to be at the side of your height of the eyes when you're sat down in a proper sofa or a chair, wherever you're going to sit. So neck posture, if it gets problems, you're going to develop neck pain, you're going to develop a disc problem, you're going to develop hand pain. So the disc is a soft gel which is there in the spine, and this disc can actually cause, so for example, if this is your spine and this is your disc, so disc is a cushion which allows for free motion of your spine. So we are able to move our neck in all directions. So if this disc bulges out, there are nerves which are run through. This is the spinal cord that comes from the brain, and there are nerves that come out at every level. So if you have a disc bulge like this red thing that is shown here, it will press on this nerve. So if it presses in the neck, it can cause pain down your arm. If it presses in your lower back, it can cause pain down your legs. So if this bulge is more and it is causing severe pressure, as you can see here, it's causing severe pressure, then there will be severe pain, weakness, altered sensation, numbness, tingling, and if you don't look at it very quickly and if you don't do something about it, it can become permanent. You may not be able to hold your pen, you will drop your pen down, you cannot hold a glass of water, you will hold that, and that even if you do an operation, it may not come back if you don't go on time. The same applies to your leg. If you start developing pain down your leg, if there's severe tingling, there's severe numbness and problems down your leg, you should as soon as possible see a doctor and get it sorted. Yeah, so that's a very important thing. Now there's probably another question, couple of questions. The numbness is usually at night time, not allowing to sleep. So if your numbness is in the night time and it is not allowing you to sleep, then that is serious. Yeah, so it may be either because there is a disc bulge and the way you lie down, the position in which you lie down, probably it is not right, and maybe that is what is causing problems. Now let me tell you, coming back to our topic about working from home, and I'm going to answer this question again in a different way. We tend to take wrong positions at home. Like for example, you like to go on a sofa watching your television and doing work. You like to lie in your bed for a few hours and do work from in your bed. So all these things you must definitely avoid, especially if you're going to do work for more than half an hour. If you're just browsing something or you're just leisurely doing something, that's okay for a short period. But if you're going to be working a whole day sitting in a sofa or a bed or on the floor, then that's not going to be helpful in the long run. So you must be careful. Now this pain at night time which is causing tingling and numbness, you need to check what type of a bed you use and whether you're using a pillow. Everybody should have a pillow to their neck. People say that you can avoid a pillow. That is not true. You need to have a pillow, and the pillow can be a very soft one, the pillow can be a thin one, it doesn't have to be very big, but using a pillow is important because the neck has a curvature and you need to maintain that curvature. For that you need a pillow. Yeah. Second thing is how you lie down, whether you turn one side, lie flat or lie prone on your stomach, it really doesn't matter. Lying on your stomach all through night is not good for your back in the long run. But yeah, occasionally going on your back and front and turning. We turn about 70 to 100 times through the night, through various positions. Nothing will happen. You're absolutely fine. The bed should be a firm bed. It should not be a bed that really sinks down. It should be a firm bed. It should be hard to firm. So there's lots of beds available commercially. You can invest in them. Make sure you change your bed every 6 years. Don't think that you can lie in the same bed for the rest of your life, and don't think your bed is a lucky symbol that if you lie in that bed that your life is going to be brilliant. You're going to end up coming and seeing me sometime. So if you want to avoid that, change your bed every 6 years. So I think these things will avoid pain and tingling and numbness in the night time especially. But if it is persistent, nighttime back pain, nighttime tingling and numbness is not normal, so visit your doctor. The next thing is suggest a few simple exercises for us using laptop. We work for about 10 hours. Yes, a lot of you work for about 10 hours. So let me just teach you, in this position, a few simple exercises. You need to strengthen your neck muscles. So, strengthening your neck muscles by movement. So you can do a movement where you can pressurize your neck. So try to move to your left side. So hold your hand and try and push this side. Hold it for about 5 counts, 1, 2, 3, 4, 5. Similarly, do the same here, and same you can do here. Holding against resistance, you can try and do these exercises. Same way, forward movement, try and push your neck forward and then push your neck backward. Yeah, and then you can also do some rotatory movements of the neck. So you can keep doing this when you're working. So as I said, every half an hour take a break. If you start developing stress and tension in your neck, then you can do these exercises constantly. Yeah, moving your neck towards one side. And you have to incorporate this in your everyday practice, especially for people in IT profession who are constantly looking at the laptop and computers, constantly checking messages and mails and answering queries. There's a lot of tension and stress that builds around your neck muscles, your shoulder muscles, your front anterior muscles, your trapezius and various other muscles really go into stress. So you need to do that, and you need to release your shoulders, you need to release your neck. So keep doing that. Sometimes you may find some funny noises and crackles. It's fine. Yeah, bones and joints do make noise, but if the noise is causing a lot of pain, then you need to be worried. But if it is not causing pain, and some people say when I do that, I hear some crackling noises like something is breaking. Don't worry, nothing is breaking. It's just that the joint friction is too much, and it's a time that you need to release the tension in your muscles. Neck massages, shoulder massages, all these things are absolutely fine, and from time to time you can have these massages which will really help you. So another question, today is scoliosis day as well. Your message. Yes, so today is World Scoliosis Day. So scoliosis is a condition where there is an abnormal curvature in the spine. For example, the spine is supposed to be straight, but if the spine was bent like this, then that is called scoliosis. So this is a condition which you can see we can detect very early in life. It is a congenital problem, usually happens very early in life. You can detect it from the time of birth, but normally between the age group of between 12 to 16, at teenage, when you have a maximum growth spurt. So the best way is to ask a child to bend down, and you will see that there's a hump on one side. Because of the curvature, there is an abnormal posture of the shoulders. They are something like that, or they are something like this. Their neck is protruding outside. When you see from the side, they are either bent forward. So these are all various ways that can be detected. So if you find a child like that, immediately you need to see a spine specialist. We need to do X-rays, MRI scans, and we need to try and find out what the problem is. If you come early, before the age of 10, we can do an operation and correct it. Ideally, up to the age of 16 or 18 years, this can be corrected, and this bent spine can become made straight by operation. And we do that here. We are a specialized center in the country to do these procedures. We have robotics and navigation and neuromonitoring and various safety devices to do this operation. So we can do this procedure. Early detection, trying to identify this problem. If you have an abnormal bend or a curvature in your spine, you should come early. You can also develop this due to posture. By if you constantly work like this, then over a period of time your spine can bend a little bit like that, and with age it can get worse because the bone gets weaker, and we call this adult degenerative scoliosis. So by 60, 50, osteoporosis, weak bones, all this can cause these problems. So that is something totally different thing, but to avoid that, the best way is to have a very strong back, a strong neck, and doing exercises and fitness. So let me summarize. I think we've been about half an hour talking. So working from home can be fun, and you have to make it fun because you have no other choice. Plan your day. Keep to a routine. So wake up in your usual time. You would go to work, have a bath, refresh yourself, have a nice breakfast, isolate yourself, sit in a place, make sure that you're not disturbed as much as possible. You have a good table and chair, and if you're using a laptop, computer, make sure, as I said, it's all in the right position, you're well relaxed. Do some exercise before you start all this. Every half an hour, 45 minutes, take a 5-10 minute break. Take a tea break, a proper lunch break. Walk up and down. Go for a walk if you can. You're allowed to. Make yourself, more with the natural light. If you're going to be sitting under a fan or an AC all day, very important you go into natural light, expose yourself to the sunlight and do these things. Have frequent meetings with your team, have dedicated times where at 9 o'clock, 12 o'clock or 4 o'clock when the whole team meets up, and has a little discussion about your work, or it doesn't have to be even about work. You can just talk about a Netflix movie that you watched, but just make sure you're connected with people. Talk to friends and family. It is a depressing time, and if you're not used to working from home, it is difficult. I, being a doctor, I've never worked from home, but yes, we all tend to do other research and other activities from home, and if you ask me to do that, for a month, I would go crazy. So you need to find ways in which that you connect with the world, especially if you are going to do this. Do these exercises. It's very important to do exercises, and as I said, if you just sit working and if you hit till 75, you're approximately sitting for about 30 to 40 years sitting, and that is not good for your back. It can cause all kinds of problems, from cancer, from heart attack, obesity, depression, anxiety, diabetes, hypertension. There's enough evidence to say that people who sit and work are a lot more prone to developing all these problems, irrespective of how hard and active you are. So that's a very important point here, which is a study done by a Mayo Clinic, where they say that even if you work 10 hours a day and you are still active, the still life expectancy of these people have been slightly lower. So the key is really to be as active as possible. I hope you enjoy your work from home, and some of what I've said has helped you. We have created a video which we can share with you as well. Visit us on our Instagram and our website as well. Make work from home interesting and make it as good as possible, because you're going to be still in this COVID situation at least for another 4 to 6 months. So I hope this was useful. My name is Dr. Balamurali. I'm a spine and neurosurgeon at Kaveri Hospital. It was really nice connecting with some of you on Instagram, and have a lovely work from home time. Goodbye.